have a better.
They're probably wrong.
They have a better understanding about it.
No, we do. You should come to Pod Therapy for all legal and financial analysis.
I didn't say that.
It's time for us to branch out, guys. We've been doing this mental health shit for too long. It's getting stale, okay? It's time to get into legal. It's time to get into financial and politics. We're coming for you, opening arguments. We're coming for you, politics.
From fabulous Las Vegas, Nevada, this is Pod Therapy. Real people, real problems, and real therapists. You can submit your questions anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. As this is a public platform, I would officially like to go on record and say that I, too, reserve the right to not purchase Twitter. And now broadcasting from the churn, that guy's Dr. Jim Job, and I'm Nick Tangent. It's time for some Pod Therapy.
I declare prima nocta.
Which apparently was never a real thing.
Oh.
Apparently that was only from the Braveheart movie.
Really?
Yeah,
Oh.
and Twitter.
Yeah,
Twitter was also
okay.
from the Braveheart movie.
Yeah, feels like that probably wouldn't be a thing, but then it was like, the British are assholes, so probably they did do that. I don't know. My point
Don't
is,
insult our British listeners.
oh, all of them. They know what they did. You know, they.
Prima nocta.
I'll tell
What
you
is
right
it
now.
with you?
know.
Who is not on the list of people that you need to upset?
I want 100%.
Why are you
of the
so
internet.
salty?
I don't know why, Nick. I just got so much hate in my heart. Listen, the pile-on Twitter, I didn't start that shit. Okay, we agree that my shit was innocuous and gentle.
Can we agree that it was you and not us?
No. Who knows who tweeted that? Okay.
Who can say?
I mean, who could say with any certainty?
Who, other than anybody who's been listening for 5 seconds?
No.
Could tell who tweeted that.
It's very important to me that all of our tweets have plausible deniability. That way, if somebody's like, oh, why did you say that? I could be like, oh, that might have been Nick. I need to check with him.
Jacob does not have access to Pod Therapy's Twitter.
I actually really want to be able to start blaming people that subscribe to the show and be like, you know, a lot of people handle the Pod Therapy stuff. I mean, who knows? It could have been any one of our minions. I really want that to be the case, just so I can have plausible deniability.
That is the case with Ice Cream Social.
yeah, that
There's
is a
like
great
20
thing.
people with all the access stuff to all of our social media.
I got messaged by
great.
Ice Cream Social while I was taking pictures and posting of Ice Cream Social. Whenever it was at Scoop Fest and they were up there with Penn and you guys were doing like the big panel.
Oh, we're all on stage?
Yeah, I was taking pictures and posting it to Instagram. It was like my entire podcast queue is on one, stage because Brian was up there the whole thing.
Yeah.
And then Ice Cream Social DMs me and goes, hey, this is a great picture. Can we get it and post it and credit you? And I was like looking at Jacob and like I realized, yeah, he would not have even DM'd me.
I would have just used it.
You just would have used like, whoever this is, they've made the accident of showing me some kind of respect. It isn't any of those guys.
Nope. Also, they're all on stage talking,
all on stage
not
talking.
on their phones.
Probably not those guys. So, yeah. So, I think we need plausible deniability, Nick. If you want to know what the hell we're talking about, there was a big, huge fight, and you can come find out about it, patreon.com/therapy. You can throw a buck in the hat, and you can be part of the fiasco that was my beatdown. It was epic.
It's nice to be able to kind of be on the sidelines and
Yeah,
just
that
kind
was
of watch
probably the largest pileup I think we've had so far. And so far,
Again,
the worst day of your life yet. Yeah, damn it. You're in on this. You're in the cartoon picture. It's us. That's who they see. They don't know it's me.
Yeah.
They know now.
They clearly do.
Yeah.
They don't even know that there is a third person.
I know. That thin
Yeah,
veil
they
of
don't.
plausible deniability.
Yeah, you're not even in the cartoon.
I know.
Yeah, it's great.
I need to redo the cartoon, and I also need to redo the bio so that it's just like a list of potential names that it could be, and they're just all puppets.
If you're gonna redo the cartoon,
Fall Guys.
if you're gonna redo the cartoon, I want to be the tree.
Oh, that's a great idea. Oh my God, why don't we do that? We just carve his face into the
No,
tree.
we don't even need to do that. We just put a hat and long hair on.
Exactly.
Yeah. Oh, that's
What do
a
you
great
think
idea.
every single ICS artist does? They put a hat and long hair on something, bam, it's
That's
Jacob.
Jacob now. That duck is the Jacob duck.
Yeah.
Well, you can come check it out, Pod Therapy or patreon.com/therapy. Also, you can find out about colonoscopies, a very deep discussion about how they're done, how mine went, how you can get yours.
Oh, and where the bet for Jim and Jacob's trivia challenge today came from.
That's right.
It's pretty high stakes.
We'll cover that later.
It's pretty high stakes. So suffice it to say, I will try
So I
very
mean, you
hard.
had a colonoscopy and you had this beef on Twitter.
Yeah.
So
a lot of
You've been quite a week.
Yeah. Yeah.
Quite
No.
a beating.
My butthole's been through a lot this week. Let's just put it that way. Between the internet and actual gastrointestinal docs.
And don't forget about the annual Vegas Therapist Chili Cook-Off.
This year's winner, it's a spicy meatball. So great questions today. Come join us at patreon.com/therapy. Don't forget, you can also jump into our fun, active live chat Discord, which is also a member perk for all levels of giving at patreon.com/therapy. Thank you for your support. First question comes from a theraproducer. By the way, if you're a theraproducer, you skipped the line, baby. You could submit those questions and go right to the front because you pay for this hot action. So our first is a theraproducer, Sarah Smith, who
I
writes
think I know
in.
her.
I think you do. And she gets to skip the line and jump right to the front. And she says, question if you want to. Oh, we do, Sarah. We do for you. It's about addictions counseling versus mental health counseling. And if there really is a so-called feud between these two fields, I'm really curious as to how both of you ended up in addictions work, I'm assuming first, and how that's informed you as you've transitioned into other mental health work. Does there really seem to be barriers with people who suffer from addiction and have co-occurring mental health disorders that prevents them from getting the proper treatment because of conflicting ideals between these two fields? Also, I've always been curious as to why these two fields are so separated from each other and have such a huge difference in education levels for said license when there's a ton of opportunity for crossover between the two, especially when looking at co-occurring disorders. As always, really appreciate you all. Thank you for your wisdom, Nick, your expertise, Jacob, and Jim.
And your ability to show up.
And yeah, thanks for being here.
No,
Jim.
I mean, that's not fair. Jim gets a bad rep. I mean, out of all the guys, out of all the people on this show,
yeah,
Jim is one of them.
Yeah,
Certainly.
And Jim, you were here too.
Yes. So
you were also here.
A beef between addictions, counseling, and mental health.
There's some really good questions.
I hope that's not true.
Oh, it.
Well, I mean, it all comes down to evidence-based practice.
Oh, stop it. Stop it. No more. My a-hole can only take so much. It's been blown out. That's enough. I'm shitting pancakes over here.
All right, okay.
Oh, Jim just farted.
So,
Patreon.com/that.
okay, a feud. I don't think I don't see there being much of a feud necessarily. I wouldn't describe it as a feud.
No.
I'll give you mine. The way this, here's what I'll start with.
Though, because there's she's talking about some stuff in here that is true.
No,
like, there's
absolutely.
a lot of interesting
Absolutely.
questions and
Yes.
Very informed question.
I'll give you my perspective.
Yeah.
And I'll tell you what this looks like from looking through the lens of my professional background
Okay.
and my current job.
Yeah. Oh, yeah,
Okay.
that's perfect. Yeah.
And I'll bet your lens may be different.
I'll bet you my colonoscopy pictures. What? Patreon.com/therapy.
Save
As in if I win, I don't get them?
Oh, no, you're getting them no matter what. They are the Christmas card.
Yeah.
That is the Pod Therapy Christmas card this year.
Okay.
Yeah.
All right.
Hey, Thera
That's fine.
producers, thank you for all your support. You will be getting lovely Christmas gear. It's going to be great. It's the ornament that keeps on giving.
So I guess here's the thing.
I don't know if I can drill a hole in all those Christmas decorations.
There's this the way. Okay, the way that I view this, it seems to be my perspective that a lot of the folks that are doing mental health work see mental health as their primary thing.
Yeah.
This is what they want to do. This is what they went to school for. This is what they want to treat.
I don't get a lot of cross-training.
No, substance use disorders are kind of looked at, and again, this is I'm not speaking for everybody.
No.
I'm speaking from my perspective. We in the state of Nevada, we've worked really hard to integrate the two, substance use and mental health. There's a special certification you can get at the state level for organizations that provide both. And they're assessed using a special toolkit that we have. We can do an assessment and we can actually put a score on how well an organization is integrating the two.
Yeah.
Okay. So this is pretty much my primary job, is doing exactly this. Okay. Now, it is my perspective that most of the substance use providers that want to become co-occurring are very eager and excited to incorporate mental health.
Yeah, that is true.
And they have kind of a very positive philosophy of wanting to integrate mental health. We want to get some specialists in here. We want to be able to do this.
Yeah.
We want to do a one-stop shop. We want to integrate these services.
And they don't see them as different. I think the addiction side is like, no, this is all behavioral health. Like,
yes.
Mental health, trauma matters, everything matters.
I don't get the same sense going the other direction.
No.
A lot of the mental health providers look at substance use more as like, I'd rather not have to deal with this, but I guess we kind of have to.
Oh, is that what it is, though?
Right.
Is it just like it's a pain in the ass?
Not necessarily a pain in the ass.
It's a mystery.
Here's the way
They're not well trained in it.
Yeah, exactly.
By the way, I phrased that poorly, and I want to say it. I was not saying that dealing with substance abuse is a pain in the ass. I was asking if that's how they see it.
Yeah.
I didn't phrase that very well. I just wanted to make that clear.
Yeah,
I forgive you.
No, and it's I don't.
Thank you. Fair. You're tough.
But I'm a priest, so
you're tough,
fine.
but fair.
But I think Jim's point is actually spot on. I think it's a comfort level thing.
Nick is the Mills Lane of this podcast.
It's something about I wasn't fully trained in this, and now I'm kind of being forced to look at it. And honestly, the way that mental health looks at substance use is the way that substance use looks at gambling.
Yeah, okay, yeah.
Because
not to get too in the weeds.
But it's a lot of that same thing where I know a lot of substance use providers that they will assess, or they'll not assess, they'll screen for a gambling disorder.
They don't want to treat it.
Hoping that the person doesn't
because they don't
screen positive because we don't want to deal with it.
Yeah.
And it's kind of the same way with mental health where it's like, okay, I'll ask these questions about your drug and alcohol use.
Yeah.
But God, I hope it doesn't screen positive because I don't want to have to deal with it.
There's a lot of there's a lot of layers to this. And Sarah, this is a really good question. So some background knowledge for everybody. One of the things Sarah points out is she's like, hey, there's like different educational requirements. In many states there are. And so like, and this, I don't want to get into the lexicon of all the different licenses, but we live in Nevada. Nevada, which is a state that's usually horrible about everything, actually does a really good job about having stronger standards.
I can diagnose alcohol use disorder and I can drive a limo.
Yeah.
I can operate a vehicle with more than 2 axles.
So like Nevada, compared to a lot of other states, does a comparably very good job of having a higher standard for substance abuse. When you go to our sister state, California, you could be a substance abuse counselor billing insurance, and they call them like RTs or whatever, and recovery technicians, and like their KDAC and all these other licenses they have. They're very light level. They a lot of them do not require a bachelor's degree. They just require some seminar training and get in there. So what that does accidentally, whenever that's your standard, is it creates a lower level of professionalism, and then that trickles throughout the entire healthcare industry, where you look at that rehab and you start seeing rehabs as shady and like unprofessional, not high stakes. You got a lot of people that were just patients last week, and then like 6 months of like some kind of seminar, now they're providing treatment. So it's developed a bad reputation in part because over all the years of the many ways the insurance industry has destroyed America, this is yet another one, because we had to pass federal laws saying that insurances needed to cover addiction and mental health. They used to weasel out of it all the time. And addiction was one of those ones that used to just be like nonprofits that were mostly providing addictions treatment. Then the Mental Health Parity Acts went in and Obamacare went in, and all of a sudden it was money train on addictions, and so addictions had to be funded, so people started getting professionalized over there, and a lot of states started requiring higher levels. In Nevada, the lowest level counselor you can be is an addictions counselor, and there's a particular tier for it. We have a CADC. We also have an LADC, which is much higher. That's the master's level. That's the equivalent of one of the mental health disciplines. But it's the only discipline that has a bachelor's level, which we call a CADC. I think it's a certified alcohol and drug counselor.
Yep.
And so a CADC intern could be a person who doesn't even have a bachelor's degree yet. They're just a student, and they're providing treatment. And they could be working at a rehab, earning their hours, earning their degree. So
you'd have to have it by the time you're certified.
By the time you're certified.
Right.
But an intern
you
can
don't
practice.
Have to. Yes.
They're practicing. So there is a lower tier, as Sarah talks about in the letter. And so there is an effect of that, because some states, and our state has a comparably very high standard of at least you need to be enrolled in a bachelor's to get a CADCI. Other states like California, nothing. You could literally just don't have a felony right now and you can get one. And so that has created a little bit of disparity in training and professionalism.
And done. I have one in California now.
Change the jingle. Change the jingle right now, Justin. I'm your RBT, Jacob. You have just been substance abused. So that's part of it.
Not even sure what that means.
You're not far off, though. That's still pretty close. So that's part of the disparity. Nick's right that there is, among the professionals, there is a little bit of that weirdness because the mental health licensed crowd, so these are your LMFTs, your LCSWs, your LPCs, your LMHCs, your psychologists, a lot of them feel queasy about addiction. We weren't usually trained in it. And the way that you really get trained, the way that I learned addictions treatment was in the field. You learn it by doing it, by getting out there and being mentored and interacting with that particular group of patients. So there is a lot that you learn on the road, and so a lot of those who didn't train in that are very intimidated. But I will say there is a shoe on the other foot mentality too. A second ago, you and I were just saying the addictions crowd generally likes the mental health crowd and supports them and wants them involved. I agree with that to a point. When you and I have had to hire mental health therapists or therapists, because we don't differentiate, we generally want people that have a mental health license first, because that has higher authority with insurances and with JCO and things
billing.
like that, and for billing purposes.
Yeah, you're more valuable.
And the professionalism. The truth is, we also look at that and think highly of our peers that when they have that. But what we really want is somebody who has that and has a substance abuse license, who earned it, and is in the field. Because one of the most dangerous things that can happen in addictions is you get somebody who shows up and goes, "Hi, I'm an MFT, and I'm here to do this." And I go, "Have you ever worked with addictions before?" "No, but I'm fully qualified." "The hell you are? You're not qualified to talk to one of my patients." And this pisses me off because as an...
Oh, good.
Yeah.
All right, let's go.
Now I want to attack all therapists who are not
Okay.
addictions
Yes.
trained. Because when they show
I'll put a
up...
seatbelt on that chair.
Yeah. And a muzzle. I think I need that too. When they show up to interview at an addictions treatment place and they just feel like they're fully qualified because they're fully licensed in their discipline, it pains me how often I've had to interview those people and reject them. And I can't tell you how many times they've called me absolutely flabbergasted. Like, I am a very competent professional. Why would you not hire me for this? And I'm like, you have no addictions experience whatsoever. And I've literally talked to people that are like, it can't be that hard. And I'm like, you are going to get people killed. And it will not happen in my rehab because you are not qualified. Like, oh, I've been taught in all the psychotherapeutic theories. That's lovely. And when you've learned how to cross-apply them to the very specific model that is addictions treatment, then we'll talk.
Well, and this is where it's a really good point to illustrate that there's a difference between scope and demonstrated competence.
Good point.
Because technically they're right.
Many
It's
of them are
within
allowed with
their scope.
They can legally treat it.
Right.
And they can't be sued.
Right. But the other thing too is, and every state is different, but if you look closely, at least in Nevada, if you look at the regulations, it is within the scope of treatments. It's within the scope of an LCSW, which is a licensed clinical social worker, to treat gambling disorder.
Sure.
However, if you look closely at the regulations, it says with demonstrated competence.
Right.
So it doesn't mean I just have the letters, therefore I can do it. It means that you have to, now there's no clear definition of what demonstrated competence.
Right.
But you need to go into it with the perspective of, if I had to defend what I'm doing to the board, what do I have
What do I know?
that I can support? I can say, okay, yes, I'm treating this disorder and I've got these certificates that I've earned from these trainings. I've got so many hours. I've got supervised experience with so-and-so who is a licensed whatever.
There is a beef. And I've been on both sides of that beef. Unshockingly, I've been pissed at everybody. I've been on the mental health side and been pissed at the addiction side.
I bet he didn't tell him, though.
For having too low professional expectations.
And
which
watch
pisses
out,
me
Girl
off.
Scouts. Don't go anywhere because you're
I'm
next.
coming for you next. So when I wear my mental health license, I look at the addiction side and I've been pissed at the low professionalism and it needs to grow. And I've always been an advocate for it to grow. But whenever I was leading rehabs, I would get in fights with ownership because I'd be like, I want a professional workforce. And they'd be like, that is too expensive, Jim. You need to get out there and you need to hire the lowest possible professional you can that will still allow us to be licensed and function and bill. And that would always piss me off because I want the higher level of professionalism because of one of the things that Sarah writes about, COD, co-occurring disorders. Mm-hmm. Many of us believe you cannot find a pure patient who only has an addiction. They all have something. Trauma, anxiety, depression, they're self-medicating. They have years of abuse from the drug itself. They've abused their bodies and themselves and put themselves into all sorts of hell and trauma just from the using. So there's so much mental health wrapped into this. I want the highest possible professionals to treat. And when we ran a rehab, that's what I sought to hire. And so I was extremely picky. But I get pissy on both sides because when I'm on the addiction side, I get all pissy at the mental health people who sit down and they're like, I'm fully qualified, I'm your guy, pay me the money. And I'm like, what's an ASAM? Tell me 2 of the 6 dimensions of ASAM. And they're like, the fuck is that? I've never done an ASAM. I'm like, you shouldn't have shown up today. You shouldn't have sent me your resume. It's embarrassing for you that you're even sitting in this office, and I'm angry that you've wasted my time. And like, that makes me very mad because nobody even thinks you need to be trained on that. And I didn't learn ASAM from my master's degree. I didn't learn ASAM 6 dimensions from my fucking doctorate. I learned it from Nick fucking Tangeman during a lunch break.
The best way to learn it.
The best way to learn it. I literally drove to I was working at a whole different place than Nick. We had been colleagues at 2 different places. And I called him and said, hey man, I'm about to sit for my boards. And my supervisor never taught me about the 6 dimensions of ASAM or proper assessment. And I feel weak on this. Will you train me on it? And he said, yeah, man, come down here, buy me lunch, and I'll talk you through it. Taught me through it, said, here's what you already know, Jim. Let me teach you the right way to channel that. Let me do a couple with you, and let me give you some case studies. Let's practice it. Drilled me a few times. I had it, and I was like, all right, I'm going to go to the boards. I'm going to run this. And I did fine with it because I had already trained in substance abuse for 3 years. I was ready to sit for that test. I'd already passed the national examination. I was about to sit for the board. Mm-hmm. And I knew that was going to come up, and I didn't feel strong on it. But again, there was no textbook. You learn by doing. And so I have 2 different licenses, and I take both of them very, very seriously. And this is another feather in the cap. I have never complimented Nevada so much as I am right now. This is one of the only areas I'm proud of our state. Our state is one of the only states that thinks it's so important to take co-occurring disorders seriously that we created a specific license just for co-occurring disorders. Even though many licenses will treat them and do treat them, we created a specific license to say it's important to fuse together both of these disciplines. And to earn this particular license, you have to have both a substance abuse license and or the requirements thereof and a mental health license in good standing. You have to have both in order to earn this other license called an LCADC. So it just, again, feather in the cap in Nevada, a state that should take substance abuse seriously because we kind of invented it. So, like, we have to be really good at it. But no, it's a really complex question, Sarah. And you're asking, I think, a really good question that has a lot of nuance to it and very much gets into the weeds. We're not as separated as you probably think. It is something that's merging more and more together. Part of that has been because of insurance reform and healthcare reform. The better the reforms have been, the more money has flown into the industry. That brings it out of the darkness and into the light. It attracts competent professionals. It raises the standard of professionalism. It incentivizes mental health people to even be trained in addiction treatments. It incentivizes addiction treatments to not be hungry for any mental health person that walks through the door. And that was one of the things I was really proud of with our rehab, to toot our own horn again, is a lot of rehabs, they do not have mental health people at the top of the food chain. So you'll just have an executive director or whatever who has no license to their name at all, is not clinical at all, and then they just hire any yahoo that walks in with a license because they're taught to kiss their ass. Because that's a real-life clinician. Oh my God, they're gracing us with their presence. Sit them down. You and I didn't give a shit because we're already clinicians. And if they didn't want to do their job, we'll do it for them. We're not scared of you. And so we would hire and fire therapists whenever we felt like it, and we would only choose competent professionals, and we'd let go of people. And that's one of the things that made our rehab very strong, is because we had really quality colleagues that we brought in. And Nick. Ha! Got him!
I'm sorry, I wasn't listening.
Sorry,
What?
you're zoning out. I was in my Jim is ranting cadence, wasn't I?
Yeah, we know.
But no, I guess, no, does the question get into as far as like from the patient's perspective?
Yeah, the COD stuff is really important because one of the things Sarah brought up is like co-occurring in mental health is huge. Shouldn't there be more collaboration to like make that division small? Yes. And we do actually value that. And whenever you study in addiction medicine, that is the emphasis. That I would argue we have left the dark ages of like addiction medicine being completely siloed as a distinct thing. It is now fully considered theory of mental health.
Well, and I think that's kind of the way that it had been in the past, because you always you have to remember the origins of where all of this came from. mental health kind of came from the psych wards,
Yes.
and substance use came from the 12 steps.
Yes.
And that was the old school way of it. And these two had nothing to do with each other.
Even though they had
were
everything to do with
exactly,
each other.
but they were,
didn't talk.
Well, they were extremely far apart.
And this
you
goes
know,
back to
and-
the lack
and
of professionalism in addictions, because the people who could help you weren't professionals.
Right. I mean, yeah. I mean, so from these programs, they just started to grow, and then eventually we kind of started realizing, like, okay, these cannot be treated in silos anymore.
They have to be blended.
We have to integrate, and we have to be able to work together, and we have to be able to treat the whole person.
Yes.
And you see this a lot now too. Like if you look at like what Jim was talking about, the ASAM, which is the American Society of Addiction Medicine, a big chunk of that is dealing with things outside of just the substance use specifically.
Right.
You know, we've got a whole part in there about emotional, behavioral, and mental health.
Yeah.
Right. There's a
Physical
whole
health.
dimension there.
Biological
There's
health.
physical health.
Yeah.
There's environment.
Yeah.
Like it's
Your family life.
a whole huge slew of stuff. They were actually talking about in the ASAM, there was going to be a seventh dimension.
Ooh.
There was going to be spirituality
Oh,
as a
interesting.
seventh dimension.
Oh.
But there's just not enough research.
I don't feel like
there's
that should
no
be there, but
I kind of agree.
Good
but
news, Jim. It's not.
yeah.
But
Let's
there's
keep it at
not-
6.
there wasn't any research to really support putting it in there,
Yeah.
so they couldn't.
Okay.
And that's why it's not in there.
But that shows how the field is developed.
Yeah, and it's
Yeah.
it's gotten very broad, and we're starting to look at the individual as more than just how much are you using, what
Right.
are you using, all this. It's the whole
This
everything around
This
them.
comes back to something I think I said in the last episode, and I made a joke about this, but it's actually true, so I'm going to say it again. The reputations that Nick and I have on this show is that Nick is like the more stoic guy, and then I'm like happy-go-lucky Jim. The reputations we have among colleagues...
Except for on Twitter.
Except for on Twitter. The reputation we have among colleagues is more like the Twitter, which is Nick is Iowa nice.
Everybody hates him.
Nick is Iowa nice. Everybody likes Nick. Nick is a great guy. Have lunch with Nick. He's a buddy. He's a friend. He's very pleasant. People like working for Nick. They like working with Nick. Everybody fucking hates me. And it's very weird because I'm actually mean. And like, you wouldn't think that I'm a mean guy. I'm very sweet to my patients, but damn do I have expectations of colleagues. And it fucking pisses me off. God, I'm swearing way too much on the show. One day my kids are going to listen to this and be like, Dad was a bad guy. So like,
Jim's kids, that's not why your dad is a bad guy.
yeah, there's so many other things you're going to find out. So once all those confidentialities go down. So
Go check that picture of yourselves on the mantle.
yeah. I haven't lost that bet yet.
Foreshadowing.
Those non-disclosure agreements are going to expire at some point. So the thing about that I get angry at colleagues about all the time, and I know we're over time on this question, I got to move on, but I get angry all the time, is I'll meet colleagues that were never cross-trained in addiction. Having gone through that myself, I look at that now and I feel like I don't know that you're competent to practice. Unless you've at least been taught how to assess and properly screen and refer. If you do not even know the levels of care in substance abuse, I don't feel competent in your training. I don't feel you're ready. I don't think you should be treating people, honestly. And so, like, that really gets me into, like, a lot of scrutiny. I criticize a lot of colleagues that I meet all the time that are interns and stuff like that. I remember I had an intern once that was like, yeah, tell me about their case. And I'm like, okay, cool. And they're like, anyway, so I think that they might be an alcoholic too. And I was like, stop right there. We're going to talk about this now. Oh, no problem. I'm just going to incorporate it in the treatment plan. The hell you are. Show me one thing on your resume that says you're competent to do that. Hell, show me what an ASAM is. Like, show me you even know how to assess this person. Why do you believe they're qualified for level 1 outpatient? Like, what's that? Give me your patient. Like, that's my patient now. You're not going to treat this person. So anyway, end of rant. I think it's a level of competency that all professionals need to cross-train in. But honestly, I'm kind of a dick about this because I think there's a lot of areas that people need to cross-train in. Like cultural competence, we all agree cultural competence needs to be as part of every single piece of graduate training. It's a CEU. We all think it's, but we're myopically defining culture as your skin color, and that is so insufficient. If you're sitting here trying to treat and you have no concept at all of Islam, you have no idea what it teaches. What you know is from 9/11 footage of Fox News. You're not competent to treat. You have not met the minimum standard of cultural competency. If you do not know one of the largest religions on earth, what it basically teaches, or some basic non-caricatured, non-lampoon concepts of this entire culture that swaths over all these nations and languages, you're not competent. I think religion should be part of that. I think political philosophy should be part of that. If you have a weird caricature view of like what conservatives believe, then I don't believe that you're culturally competent to treat. And right now, among this woke liberalism that we have right now, therapy is very much being sucked into that vortex. And sorry, I'm getting my soapbox. I need to go back to silly ass Jim. But like this bothers me, because then there's a lot of these woke therapists that are out there. And then they're bitching and moaning, and they're like, conservatives are nonsense, or they're out there like, Trump's a malignant narcissist, and that's a disorder. And it's like, you are culturally incompetent. You're not fit to treat. If you're going to demonize 50% of the American population with caricatures and lampoon images of what they actually believe, then you shouldn't be treating anybody, because you're going to get somebody killed. Like, you're not fit to treat. That's part of cultural competence. All right, end rant. We're going to take a quick break, and when we come back...
You take that stuff to Twitter where it belongs.
Yeah, sorry. We're going to talk about fawning. You're listening to Pod Therapy.
This week's episode is brought to you by Smitty Scoop. Wait, hold on. No. Yep.
No.
Smitty
No,
Scoop.
no, screw you, Smitty.
Jake Schneider.
And
Carolyn
Jake.
Albert.
And Carolyn.
Kevin Chamberlain.
And
Ben
Kevin.
Stanley.
And
Filer T. University Jeff. And Tess Miller. And if you would like to sponsor a show, head on over to patreon.com/therapy and sign up as a therapy producer.
Yeah, do it.
Go ahead and do it. Just do it. This week's trivia theme in honor of our therapy producers is 90s daytime TV talk show hosts.
Oh, damn it.
Right.
I think I bet way too high stakes on this
before
one.
Before we say the question, we should say what the bet is.
Yes, go ahead.
And that is, if Jim wins trivia today, he gets to drive my truck, and that was his idea. And if I win, Jim has to replace 2 framed photos of his children in his house with pictures of his recent colonoscopy.
And I have to leave them
And they
there
have to be left until they notice. Until somebody
a family
notices
member
them.
notices
Yes.
and protests.
High stakes.
Oh, I don't think they even have to protest. You can just swap them after
I
they notice
really
them.
think I should have asked for something more than driving his truck down
I
the road.
agree.
I feel like I really didn't get
All
much
right,
out of this.
here's our question.
Also, I think that means I have to drive your car.
Yeah,
Yes.
I don't even know what I really got.
Yeah.
It's a cool
Nothing.
truck, but
Okay.
who cares?
Yeah.
This 90s daytime TV talk show host started out as a drummer in a rock band, then became a stand-up comic, and was a contestant on The Price is Right, The Match Game, Press Your Luck, and Star Search, all before getting her own talk show.
Oh, thank goodness for the gender pronoun.
I know, because
Yeah.
you were thinking drummer has to be a guy, and you are a sexist, Jim.
Yeah, he got me. That is, I'm just not even.
Is
gonna
it
deny
A?
That is true.
Oh,
Oprah-
it's multiple choice.
Oh, we're getting
All right.
multiple choice. Thank God. I thought we were just gonna have to
Gee,
go
yeah.
back to the '90s and just wing it.
Is it Oprah Winfrey,
Phil Donahue, final answer.
Maury Povich.
Rosie O'Donnell,
Ooh.
Jenny Jones, or Ricky Lake?
I want Ricky
Shit.
Lake. Final answer.
None of the ones that the one that I had in my mind was just not there.
Go on, Ricky Lake.
All right, give them
The
to me
world
again.
needs
Oprah?
wannabes.
Rosie O'Donnell,
Uh-huh.
Jenny Jones, or Ricky Lake?
Uh,
Give it to
can
me,
I ask a
baby.
question?
Yes.
Who is Jenny Jones?
Give it to me, baby.
So Jenny Jones was
Jerry Jones's wife.
Ah,
Yeah. Yeah.
so.
same question for Ricky Lake.
Yeah. Oh, Ricky Lake was
Oh,
in
I
the
used to
Offspring
watch
song.
Ricky Lake all the time.
Yeah, me too.
She was.
I-
All the
know
girlies
Ricky
say,
Lake from
"Pretty
the Offspring
fly
song."
For a white guy. Bam.
I didn't even realize that was. Okay, so Jenny
That's why he
Jones had a
likes CRT.
TV show.
Yes.
There was a big controversy because she had 2 people on the show, and this guy came out and he was surprised. They didn't tell him why he was there, and his best friend said that he came out as gay and that he was in love with him.
Okay.
And then 3 days later, this guy killed that guy.
Ooh, I remember
Yes,
that.
because that became a huge court case, and like, okay, is she responsible?
And
for
that's
all
Jenny
this?
Jones.
That was Jenny Jones. Yes.
Man,
Okay.
if your last name is Jones, you just get people killed. Like that just seems to be a thing.
All right. So what all was the steps of the career here? Because Jim is locked in Ricky Lake over there.
Done. I'm done. I've already got the answer. So
Yeah.
you're gonna lose. You're just delaying the inevitable.
Okay, so I gotta pull it up.
Drummer?
Again, sorry, she was a drummer,
Uh-huh.
then became a stand-up comic,
Uh-huh.
and then was a contestant on The Price is Right,
Right.
The Match Game, Press Your Luck, and Star Search.
Yep.
Before getting her own talk show.
It's Ricky Lake.
And the options were
Oprah Winfrey.
Oprah,
Rosie O'Donnell,
Rosie.
Jenny Jones, or Ricky Lake.
I'll go Rosie.
I feel like Rosie's the runner-up for me too. That would be my only.
I'll go
nervous,
Rosie with the stand
I
up.
have some nervous energy on Rosie.
Also,
Yeah.
the one that I was thinking was definitely going to be Sally Jesse Raphael.
Oh yeah. Oh, that would have been a good one. I also feel like Rosie may have actually been on Star Search, and now I'm.
I think she was.
I'm starting to doubt Ricky Lake, but
Yeah.
I already went in deep.
I'm
on
going
that.
Rosie.
You should definitely doubt Ricky Lake.
Oh,
And you should definitely doubt Rosie O'Donnell because the correct answer is Jenny Jones.
Jenny Jones. Oh,
We got Jones.
We did.
It all comes down to the last question.
It does.
Ooh,
We
all
might
right.
need a tiebreaker.
High stakes. Oh god, this is scary. All right, second question: is my marriage doomed to fail?
Yeah,
I thought
probably.
it was fawning.
Probably. You'll be fine. No, wait. Yep. Sorry. The second question: fawning. Spoiler
Or,
alert.
I'm sorry, was that just your question to us?
Yeah, no, I was just talking. You guys never really listen to me, so this is how I drop hints that I need help. Fawning. Hi, guys. I'm a student who'll be finishing my bachelor's in human services next May. It's been a great experience. I'm the old dog learning new tricks at 52 years old. Anyway, we recently touched on a concept called fawning, and I instantly recognized it as what I do. My question is, how do I stop? Background, I have just over 3 years of personal therapy invested so far, working on my knee-jerk reactions to feelings of not being good enough for others. I was put up for adoption and then basically raised myself because my adopted mother suffered with alcoholism. So, when I meet people, I just listen and watch and mirror back whatever it is that I think they want me to be. I always wondered why, and I never felt like I was lying because I will legit be whatever people want me to be just to see them happy. And then if they are, I am. And if they are not, then I'm a loser. It's always confused me. So, help. Thanks, Anonymous. Really good question.
Fawning.
Yeah,
Define this.
people pleasing.
Okay.
Yeah,
Yeah,
people
I mean,
pleasing.
the definition of it is displaying exaggerated flattery or affection.
Yeah.
But the
So
way
not what Jim does on Twitter. The opposite of that.
Definitely
the
not.
opposite of Jim on Twitter.
Yeah, people pleasing, being kind of jello and molding to
Okay.
other people, and yeah, so that kind of angle. But a couple of things, really quick, Ryder. I love how you phrased this, where you said I've invested 3 years into personal therapy. I just really liked that word. That was a cool phrase.
Therapy?
Yeah, I like that. I believe that's how it's pronounced. I believe it's French.
Yes.
Yes.
Yeah, the investment part definitely.
Investment's a good word.
That's a very positive way of looking at it
I like
because you
that.
are anytime you're investing something, you're giving something up of value so that you can get something of greater value later. So you
Yeah.
are giving up your time, possibly giving up some money so that you can, that this will all pay off in dividends later on in
The
life.
return is very good.
Yeah, so that's a great way to look at therapy. This is a really good question. I mean, to what extent, Jim, do you think the being adopted played into this?
Yeah, I mean, the backstory obviously sounds like it connects some dots, right? Because I think that so I don't know that there's a hard and fast rule on this. I've never seen any hard research on this, but I think humans who have been put into adaptive environments. So like, I believe I do this. If you're playing Jim's Neurotic Bingo at home, go ahead and stamp fawning, I guess is a new word that we can use, or people pleasing.
Go ahead and just write it in.
Yeah. Among my patients, I am like this, where I very much want them to like me, and I am very adaptive to the human I'm talking to. There's always something about my history and my human experience that I feel I can bring to the front of who I am that will better match that person and facilitate the work they're here to do. Which also means that most of my patients have met a slightly different version of Jim, and a Jim that was kind of a little bit more customized to fit them, which I believe I developed as a character trait because I moved so much throughout my life. I've lived in, I forgot. It's like 9 states. By the time I was in 3rd grade, I had been to like 6 or 7 different schools. So I had to quickly figure this out. Military families also tend to have this attribute, where the kids in military families have had to move and get along with so many different people. They become very adaptable. And so I wouldn't be surprised if that's a factor for Anonymous, if maybe this attribute, which sounds like it's been...
Yeah,
whatever.
he said it attribute 3 times this show now. I feel like we have to stop this.
It's not a tribute?
It's attribute is the verb, attribute is the noun.
What?
Yeah.
What's a noun? What
Just
are you talking
finish
about?
the email.
I thought a noun was a person.
Place or thing.
It's none of those.
It's an attribute.
Yeah.
That's a noun.
Attribute is a word.
Yes.
It's like a noun, but not a noun. It's a thing. Like a
You can
A thing?
attribute.
It's a what?
well,
It's a thing?
It's a rhetorical word. It only
It's
means
not
itself.
rhetorical.
An attribute is an attribute. Like a noun
Yes.
is a person, place, or thing. An attribute is an attribute. It's an attribute.
That's what we
it's
said.
a
Which is a
describing
noun.
word.
Which is a noun,
It's
yes.
not a noun.
It
It's
is.
a thing. It's like a verb. Like there's nouns,
nope,
verbs,
It's
and
not
attributes.
a noun. It's a thing.
There's nouns, verbs, and attributes. They're all parts of speech.
That's terrible.
That's a thing. It's
You
not
are-
a thing. It's a rhetorical thing.
Oh, you are a dumb person.
No. Do you see what I'm saying? A verb is an action, right?
I understand what you're saying.
And a noun is
And
a
you are
person, place, or thing.
wrong.
And an attribute is a quality.
You can
it's a
attribute.
describer.
You can
It's an
attribute
attribute.
something to someone.
That's why they're called adverbs. Is because it's a combination of an attribute and a verb.
Oh,
It's a
I desperately wish that I could look at Jim right now and think he's kidding.
Did you guys never see School of Rock? I don't get what I'm getting wrong. I'm
We
not
were
right.
correcting your pronunciation.
It's the pronunciation.
Okay,
But
so we all agree
everything-
attributes, verbs, and nouns are things.
No. Everything else that you have said since that correction has been wrong.
I'm so confused. Attribute is a quality.
Yes.
You have attributes, I have attributes.
Correct.
But you are a
It's
noun.
not a part of speech.
Like the word Nick is a noun because it's a person. And like
Nick is a proper noun.
Nick-
Sure.
Yes.
ran is a verb.
Correct.
Nick ran quickly is an adverb because it's an attribute of the verb.
You're saying adverb.
Adverb.
Nope. It's
At-
not AT
attribute.
verb. It's not
Attribute.
AT verb.
It's an attribute verb. It's an adverb.
Hold on. I'm sorry, writer. We're gonna get to it in a minute.
We're coming back. We're coming back.
I don't even remember the question. Oh yeah, fawning.
A quality or feature regarded as a characteristic or inherent part of someone or something.
Is it an attribute?
That's an attribute.
Yeah. That feels right.
Regard something as being caused by someone or something. He attributed the firm's success to the efforts of the managing director. Would be a use of the verb form of the word attribute.
Attributed.
So you have an attribute. You can attribute something to someone.
Attribute.
Neither of those things are a part of speech in and of themselves.
Are you sure?
Yes.
Then what's the thing that you say for describing something?
You're thinking of an adjective or an adverb.
Oh,
An
it's called an
adjective.
adjective. Yeah.
Yep.
Yeah.
Yeah,
That's the thing.
Would you like to agree now that everything else you said was incorrect?
It's called an adverb.
Would you like to agree with that?
Yeah.
True or false, Jim?
We're gonna edit
Everything
all
else
this
you
out.
said was incorrect.
We're gonna edit all.
No,
of
no,
this.
we're not.
We're gonna cut all this
Nope.
out.
I'm editing the show this
Back
week.
to one. Back to one. Fawning from Anonymous.
All we have to do is continue referencing
Oh,
it.
yeah, yeah.
And then he
Hi
can't get out.
guys, I'm a student who'll be finishing my
Jim
bachelor's
didn't know the
in
difference
human
between the word
studies.
attribute and attribute and thought they were both parts of speech.
Damn it.
It's done.
All
All right, so here's the thing. Oh my god.
Jim is just beaten. He's had a long week.
Hey,
It's
hey,
definitely an adjective.
Jim, you got to look at the bright side. No one is going to remember anything about geography.
That's true. That's
Geography is done.
Out the window.
Nobody cares.
It's done.
Yeah, was Jim good at geography? Who knows?
Don't know, don't care.
That T-shirt I have of
Yeah.
your drawing of the United States is no longer relevant.
No, not even
Ever.
for sale anymore,
Ever.
right? Yeah, pull
I'm gonna
it
have
from
to
the
wear it
shelves.
inside out.
That's right. Yeah, nobody will care. I think School of Rock, Jim, is a great idea.
Yeah.
I just want to be the little book teaching people about attributes. All
I
right.
hope the people on Twitter who are yelling at you
Yeah.
decided I'll check out the show.
Yeah, I'll give it one listen.
Also, are you trying to say School of Rock or Schoolhouse Rock?
That one.
Okay.
What was the first one?
The first one is the Jack Black movie.
That was better.
I mean, it's a good movie,
It
too.
is better. It is
It's
much
also
better.
a good stage play.
Schoolhouse Rock.
Yeah.
Is the one I was thinking.
All right. Okay.
Uh,
All right.
This is the best day of my life.
I'm still not convinced I was using attribute. What
You
was
were
I
just
saying?
pronouncing it incorrectly.
You were using I think you're using attribute instead of attribute, or the other way around. Whichever
He
one,
he
you were
kept
using
saying
it backwards.
No, he kept saying the verb form when he meant the noun form.
Yes.
That's so dumb.
But
was
that's the only
saying-
reason we were correcting you at all, was you
Attributing-
mispronounced the word several times.
So if I said something like, "Oh, you're attributing that song to
Correct.
Poison," when
Nailed
it was
it.
really that is
Yes.
the
Yeah.
verb. Yeah. Okay.
Yeah.
Well, and I was
The
saying
noun
attributing.
is attribute.
Yeah. You were saying you have an attribute that causes you to do this.
Oh.
But you meant to say attribute.
Right. So we just
think
stopped to
what I
correct
meant
for
to say
the
is,
pronunciation.
This is
And
not.
then you dug a hole and filled
No,
it with
that's not
snakes
what
and
happened.
jumped into it.
No. This is not the best song in the world. No.
This is just a tribute.
Yes.
Which is a different thing altogether.
And in
I feel
fact,
like that's
it's
your
two
opinion.
whole different words.
That's just your opinion. We were talking about Jack Black, and I feel like I brought it full circle.
This is just
oh,
attribute.
oh my God. Okay.
My last thought to the fawning person, I think that this will end up being a skill that actually helps you if you're studying to become a therapist or if you're going into human services.
I do too.
I think it's a really good quality to have. However, I like that you're working on it. If it's a problem for you, I'm glad that you're working on it.
Well,
Also, don't skip those English classes.
and
Apparently, you don't
honestly,
need those to be fine.
I was just going to get into, at what point, because we always have to figure out when does it become a problem,
Okay.
right? Because it's a positive skill. You've learned it. It was meant for survival, and that as far as social survival, you had to get into those social groups and you had to fit in. So it was a useful skill at that moment. When does it become a problem? Well, it
Right.
becomes a problem when you kind of start losing your self-identity.
Yeah.
Because you're trying to figure out who you are based off of who other people are
Mhm.
instead of figuring out who you are just by yourself.
Yeah.
And just so then it kind of becomes a problem. And then also the other thing that I think is problematic is when people don't respond to it, then you have a value judgment on yourself.
Yes.
Oh, yeah.
That's a problem.
That's a
that.
good
I never even thought about that.
Yeah.
Sure.
Yeah, so I think that's probably that may be a great place to start, is kind of looking at that and just
like
saying
that.
this isn't a value judgment on me.
Mm-mm.
This is okay. For whatever reason they're just not into me, which is fine. People aren't always going to be into every other person.
Right.
That's,
and that
that's
doesn't mean
normal.
you failed. But you
Exactly.
know what? Again, I do think that this will end up being a helpful skill to being a therapist. Like my natural anxiety about other people not liking me or me making another person uncomfortable causes me to have a level of intuition in therapy that you can't learn from a book. And so like I'm constantly reading the human I'm talking to, looking for ways to be helpful to them and get them where they need to go. But I'm also taking a very Rogerian approach, which works very good for me, which is, hey, we're going to get a lot further with sugar than vinegar here. I'm not here to put you down or criticize you. I'm really believing in you, and I really want to be the one human on earth who truly understands you and that you look at and say, hey, this guy gets me and he likes me, and therefore I must not be such a piece of shit. And like I genuinely do like everybody, but I also want that to come through. And so like this kind of personality type of mirroring fawning, it lends itself toward that.
And another way that I kind of look at it too, because we all do this to some degree,
Sure.
right? Because we all want to put our best foot forward, present our on-stage persona when we first meet people.
Right.
And I think what I tried to do is I try to be as honest as I can with myself when presenting myself to other people.
Mm-hmm.
So if I disagree with somebody, I may not use that moment to say like, well, I disagree, blah, blah, blah. This is how because I just don't want to go down that road. So
Right.
I don't engage.
Right.
As opposed to the alternative of if you're people pleasing, then you start agreeing with things that you don't actually believe
That's a good point.
because you want to make that connection.
Yes.
Gotcha.
So it's
Yes.
almost like I use the example. I use this a lot in like talking about therapeutic techniques. It's like playing tennis.
Yeah.
If I'm teaching somebody on the other end how to play tennis, and on their side they've got a tennis ball and a football and a basketball and a hockey puck and baseball and all these other things, they're going to start hitting them over to me. I'm only going to hit the tennis balls
Good
back.
point. Yeah.
I'm not going to scold them or
Nope.
point out this disagreement that we have.
That's right.
I'm just going to let it go.
Right.
When they send something over that I agree with, I'm going to hit that back.
Yes.
So I'm still being honest with myself.
Yeah. And so last thought for the fawning person here, learning techniques like offering silence, which and also allowing yourself the dignity of discomfort. You're going to have to learn those skills if you're going to go into a helping profession. I had to learn them. I had to become comfortable allowing some presence of discomfort for teaching and guiding purposes, and how to counterbalance my saccharine desire to make sure everybody's always happy by allowing some of that discomfort because it's teachable, or allowing some balls to just hit the ground that I didn't volley so that they could learn, okay, I don't think Jim doesn't like me. I'm not getting that impression from him, but I don't know that he resoundingly affirms what I just said.
Yep.
You know, like, and this happens going back to addiction. You know, you'll be talking to somebody and, you know, we'll make light of some things. They'll be like, yeah, so anyway, you know, I just really wanted to chug a fifth right there. You know what I'm saying, brother? You know, I don't reward that, you know, because I want him to realize, hey, we've been normalizing your behavior for like a long time and I like you too much to do that. Right. And so like, I won't play that game, but then we'll come back to, hey, recovery's pretty great, isn't it? You know, and so same thing, but great question. Man, we got some really good questions today.
Oh, yeah.
And some really good grammatical insights. I feel like
The amount that you dig in
we're learning
when,
so
when
much
you were
today.
told that you're wrong.
That's what makes it so much
It's
fun.
amazing.
It feels right at the time. Like my neurons are like, no, this is definitely right. Like the Ricky Lake thing. I'm still kind of pissed about that. We're going to take another quick break. And when we come back, we're going to talk about whether a marriage is doomed to fail. You're listening to Pod.
Oh, good. We're getting to that one today.
Smitty Scoop, Jake Schneider, Carolyn Albert, Kevin Chamberlain, Ben Stanley, Byler T, University Jeff, Tess Miller, thank you. And if you want to become one of those names, go to patreon.com/therapy and sign up as a Theraproducer. That's how it gets done. All right, our second question. This 90s daytime TV talk show host hosted the episode of Good Night America that was the first national telecast of the historic Zapruder film.
What the hell's Good Night America?
It's not relevant.
It's a good start, though.
Is it A, Geraldo Rivera, B, Phil Donahue, C, Montel Williams, or D, Jerry Springer?
These are all really good options. I feel like Springer's a throwaway.
What year is this?
I didn't give a
You
year.
didn't give a year. Okay.
And
Oh, do you not have a closeout? Are you done?
No,
I'm done.
Okay.
Springer used to be legitimate, and he was like a newsman or something.
Springer was going to be, like he was definitely going to be a legitimate talk show host.
Yeah.
And he was also the mayor of Cincinnati
That's
for a while.
right. Yeah, it was. See, Donahue feels like a strong one.
I'm going
Montel?
Donahue.
Yeah, I feel like Donahue.
I'm
was
going
the
with
right
Phil.
answer. Phil Donahue does feel right. You said Geraldo Rivera?
Yep.
My first thought was Geraldo, but then Donahue came out, and I was like, it's probably Donahue. But then Montel came out, and I was like, heck, it could have been Montel.
Yeah.
So I don't know.
Of course, you don't know what they were doing since you don't know what the Zapruder film was or anything like that.
I don't even know a clue what that is.
Yeah.
Did you say that they're all daytime hosts?
Okay, I'm gonna have to explain this because
Yes.
it's
Yeah.
probably relevant.
It is relevant.
Yeah.
You kind of brushed it off like it didn't matter. It's definitely relevant.
Yeah.
The Zapruder film is the film that captured the JFK assassination.
So
from-
serious shit.
Yeah,
Oh.
so from 63 until this, which I believe was 75, no one the public had never seen that.
Oh, wow.
So this was, I believe it was 1975, but this was the first time the American public actually got to see that film.
Oh, dang.
And it aired on this episode of Good Night America.
Oh, wow.
Yeah.
Oh, I don't think Springer. Yeah, I think he's out.
Man, I really want it to be Springer.
I don't think, Montel feels like a very strong choice, but I feel like Geraldo Rivera ended up going later in his career towards serious coverage and became like a newsy guy on Fox, which is about as serious as he's capable
Geraldo
of.
was definitely a news anchor and like a reporter and such before doing daytime TV.
I just don't know if he was big enough at that time, because at the time Geraldo was kind of a joke, but I feel like Donahue was serious. It's gonna be Donahue, but you already took Donahue,
I've locked in Donahue.
and I believe
Much the
in
way
a
that you locked in
game
Ricky
of
Lake
chance.
the first question, and that worked out so well.
Hey, shut up!
I'm
You
copying
failed
that.
too.
I'm being self-deprecating.
Oh, okay, good.
Asshat.
I'll take it. I'm gonna go with Geraldo Rivera.
Geraldo.
Give me some Geraldo.
I mean, I don't hate Geraldo there.
I think it's
Geraldo is
it's
my
the
number 2.
Best of the available options.
He's my number 2 on that.
Watch it be Montel.
Okay, you're locking in?
I'm on Geraldo.
You're locking in?
I'm Phil Donahue.
This kills me. I really wanted to see those
Hold
pictures.
on. Say who it's not first. Walk us out. Like do it.
It's
like
not Jerry Springer.
Oh,
Yep.
It's not Montel.
Yep.
that's one of us.
And it is not Phil Donahue.
Oh, I was
It
scared
was
of it.
Geraldo.
It is Geraldo
Oh,
Rivera.
look at him
Jim
go.
gets to be a truck driver. Yeah. Woo!
What kind of truck do you think I have?
Oh, I don't know. It's a big one. I mean, it's that one across the street that says night transportation.
That's it.
Right? Okay, good. I'm going to go take that one. That'll be fine. All right, last question. We'll wrap it up. Is my marriage doomed to fail? Background. It's almost our 10-year anniversary, married 15 together total.
Great.
We have 2 children, ages 6 and 3. I don't know if that's relevant, but everyone says that we're in one of the most stressful parts of our marriage. Some more recent stuff. My husband runs his own business, a family business, but he's down to a one-man working crew because his father is going through cancer treatment. Where the breakdown started, I came out to him that I am asexual a couple years ago. His response was either...
Oh, asexual.
Asexual.
Got it. Okay, thank you.
His response was either 1, divorce, 2, celibacy, or 3, opening up the marriage, none of which he really wanted to do. I said it didn't need to be any of those. After going through couples counseling, we improved our communication for a short time. I let him know that even though sexual intimacy wasn't my favorite thing, I explained to him that I know it's important to him and talked about what I need on a day-to-day basis for me to be in the mood. I think the stress of the family business and him overworking himself with the stress of his father going through cancer treatment has really got him disengaged and down. Every time I try to engage with him, he completely ignores me or rattles off about what's stressing him out at work. When I ask what I can do to support him, he says nothing or I don't know. The latest issue is that he thinks we need to be in couples therapy, but doesn't want to pay for it. We had a tough conversation where he said that I'm the one not being engaging enough, but I've been trying. Every time I ask what I can do to help him, he turns everything into being my fault that we're having these issues in the first place. I'm tired of trying, and I'm at a loss of what comes next. TLDR, how do you know when a marriage is over? When one party is trying and the other one seems unwilling to engage? Signed, me. Pronouns are she and her.
Man, that is a lot just going on in life.
A big one.
Kind of a, boy, the word is not sexual awakening here, but a sexuality realization,
Sure,
perhaps,
which appears to have been a game changer in the
Yep.
relationship.
Father/father-in-law in cancer treatments.
Yeah, one-man business.
One man or one man crew.
One-man
Which
crew.
I'm unclear if it's the husband is the one man crew or if it's the husband plus one man.
Shorthanded.
But either
Either
way,
way.
tough. That's tough.
Yeah.
And 2 young children.
Yeah. Oh, that's right. I forgot about the
Yeah,
kids too.
yeah.
Ooh,
2 young,
geez.
3 and a 6-year-old. I
And
think.
they've been married 10
Yep,
years,
yep.
so it's been together for 15. They've been together.
Been together 15 years.
a long time.
There is
Wow.
a lot. I'm purposely rehashing all of that to remind everyone there's a fuckload going on here.
Yeah, this is interesting. I've been together 15 years. My kids are similar to these ages. I have a one-man business and only have one crew member. Nobody has cancer. We're okay.
Okay.
But still. I'm just saying. I relate. There's a lot to relate to
Thanks
here.
for turning this back to you.
Yes.
Yeah.
Well, I did sign it. It's signed me.
Right.
My pronouns are not she and her, though.
Yeah.
So close.
Yeah, where do you start?
Geraldo Rivera.
Okay, after that.
Man, there's a lot of layers to this, huh? So, okay, let's start with asexuality. It
Okay.
doesn't get talked
Great.
about enough. That's important.
Love it.
So, go ahead.
Well, I think one thing here with this is I think we have to appreciate how big of a deal that this is.
Okay.
Because I think sometimes this could be kind of pushed off to the side as like, okay, yeah, I don't really like sex. I'm asexual. Well, that can be a pretty big deal in a marriage.
Mm-hmm.
Because even if you kind of come at that from the perspective, because, sex may be very important to the other person. And even if you come at that with the approach of, well, I'm not saying we can never have sex. I'm just saying that I'm not really into it.
Mm-hmm.
Well, just saying that has
Right.
an impact,
Sure, yeah.
right?
Yeah.
Because if I'm in that relationship and I know that the other person doesn't really want to do this, then
Right.
I feel really weird about being in that situation.
Yeah.
I don't want to pressure the other person into doing something they don't want to do.
Right.
And it's not my ideal.
And it could be
of
important
what-
to the other partner that their partner is enjoying the experience. That can be an
Yeah.
important part of
Yeah.
their sexual experience. as well.
Exactly. Yeah. And so,
So I mean, yeah, this is not nothing.
yeah, exactly. And
Oh,
I
no,
think
it is
that's
not
that's
nothing.
I think that's
No.
kind of the first thing that I wanted to point out is this actually can be a very big deal.
It is, and I think for multiple reasons. A lot of the discussion of like what the list of letters should be for LGBTQ it continues to grow, and A is often discussed as something that needs to be included, and that stands for this asexuality. And those who feel that this is true for them, they really want to be seen as a group, and they kind of want some validation for their particular perspective because their view is this is a perspective and it needs to be validated too. And really, if you think about it, like if your spouse had come out to you and said, "Look, I'm gay," but I love you, I love our family, and I'm willing to still continue to make love with you, because I know it's important to you and it's what I signed up for, but that's not my authentic truth. Okay, like that is the same kind of level of disengagement between these two people, or can be.
Right.
And that's the legitimate life choice, and that's your authentic truth. And it can be very difficult for you to fake that. And again, the writer's not being unfair. The writer says, "Look, I'm willing to do it," but it's also very important that the writer be validated.
Yeah.
Yes.
And that the person who identifies as asexual not be villainized.
Yeah.
Yes.
That's important too.
Exactly. And that was the thing I wanted to really point out too, is that we're not saying that this is the writer's fault or this is the writer's doing. This is if this is who you are and this is your true identity,
needs
you
to
need to
be-
respect that.
Well, I mean, and what you're saying
you
is
should-
validate.
what
Yeah.
you're describing there is the reasoning behind the desire to have that A put
Right.
alongside LGBTQ
To
plus,
enshrine it.
all
Right.
of the letters
Because
to go
if
along
this
with
same
there.
letter had said, "Look, I am gay," then we would be talking about, okay, wow, that is your
All we're saying
truth.
is that is who you are. And
Yeah.
yes, exactly.
But we're also appreciating the practical
It's a big
bombshell
hurdle.
that you're describing.
Yeah.
That there is a huge impact and it is affecting the marriage. And I do think that that's important because one of the things that when I do couples work that I am always curious about is things like, are they having sex? And like, how much of an asset can that be to the reconciliation work that I'm trying to do? Because every once in a while I'll find couples, not every once in a while, it's pretty common. But if they have no desire for each other at all, sometimes that's a liability. Not always. A lot of times it doesn't matter. Sex is not inherent to the idea of relationship. Go see the love triangle or the triangle theory of love. Love triangle is a very different thing. Don't Google that. Google triangle
Or
theory of
do.
love. Or do you. Whatever. Just put safe search off and have at it, Oz. But if you type in...
Do it at work. It's
Yeah,
fine.
do it at work. Absolutely do it on your work laptop. Do it in your boss's office. But go to Triangle Theory of Love and you'll see that passion is one of the big three ingredients, along with intimacy, which is that close bond friendship, and commitment, which is loyalty and family dynamic. But passion being important, but not requisite. You can have a healthy relationship and not even have passion in it. So it's possible to do it. But back to my point, whenever I'm assessing couples, sometimes it's a liability. If I discover that they don't have a lot of desire for each other, it's interesting because that, as the Bible says, covers a multitude of sins, which is a metaphor now for the idea that it lubricates the joints of the vehicle. Like if a couple is just interested in each other and desires each other, they'll overlook a lot of things they could have taken offense to or little qualms that didn't get resolved because they're like, I'm still kind of pissed that you left the toilet seat up, but I really want to hit that. So like, let's get along. And they just find a way through it, and biology covers the difference, right? And so they have a little bit more cartilage on the bone. But in relationships where there isn't a strong sex life, sometimes that can be a liability. Again, triangle theory of love, it doesn't have to be, but it is a factor. So going back to validating what you were saying, Nick, as we qualify each ingredient of this, the sex is a factor. That does matter.
I mean, so as far as how do you know when it's over? I mean, as far as talking about how much each party is willing to invest. I mean, I would agree that when somebody is when they're just kind of done and they're not willing to invest anymore, or they're not really willing to put any more work into it,
Right.
that's pretty much a sign that,
That's not good.
yeah, I mean, maybe you can bounce back from that. But I mean, you can't stay at that point.
Yeah.
At some point, both parties kind of have to get
Yeah. And so
involved.
in this scenario, one of the things that makes this question, I think, also very interesting, I believe it's one of the first writers we've had that's talked about asexuality, gave us a chance to address that, which is very important. This letter is also interesting because here the writer is saying, I'm the one who doesn't want to try. My husband, he wants couples therapy. He says that he would like me to be more engaging. And writer says, I think I'm pretty engaging. I'm unwilling to go to couples therapy. I'm not feeling very motivated to connect anymore. And then the writer says, is this how I know that it's over? Is because I'm disengaged. I'm the other party that's unwilling to engage. And that, I like the honesty of that question. I think you're asking a good question. I would want you, writer, to start with some individual work. I think before you guys can, because I agree with you, if you show up to couples therapy and you're the flat tire that's not interested in doing the work, you're not self-motivated, and here we are as a therapist saying, hey, use female pronouns, but just gave us the name me, so whatever. Hey, me, I want you to try this homework, and I want you to make this effort. If that's lost on you, because you're like, yeah, I'll go through the motions, I guess, because you're a therapist and we're paying you to teach us, but you don't actually care or want that, then we need to stop. I don't want to do couples therapy right now. The first thing I want to do is sit down with me, the writer, who called themselves me, and I want to say, hey, let's sit down with you for a second, and let's just talk about this 15-year thing that you've had, this partner who's helping you raise your kids, the stress that you're watching them go through, the way you've been treated, what you've learned about yourself, and what your feelings about relationships even are. Let's just figure out what you need and want right now. Maybe what we need to uncover is your own motivations. Maybe as we triage that, we'll realize you're done. And you really don't want this anymore. And it's not because you don't love anybody. It's not because you hate anybody. You've just reached some kind of inner commitment to yourself that you're like, I think I just want to be a single parent. And for whatever reasons, this is my value now. Okay, I want to flesh that out carefully because it's going to affect 3 humans' lives who have signed up for something with you in good faith. And if you're out or you're done, which to me is similar, writer, I want to uncover that and make sure we feel good about that conclusion with you, and then think about how you ethically want to manage that in these other people's lives.
Would you encourage them to put couples counseling on hold for a moment while
I'm
she
very
seeks
curious.
just individual?
If this couple came into my office and if I got this exact letter of information from me, quote, the writer, I'm just going to say writer.
Yeah.
Why not?
Thank you.
Yeah, that'll be easier. If I got that from the writer, I would probably say, hey guys, next session, I think I'd like to meet with writer alone. And I wouldn't keep it a secret what I'm going to talk about because I don't do that in couples therapy because that's the agreement is where it's not a secret, but there are some things I will keep private if I don't think it's relevant. And I would say, I think writer and I need to do a deeper dive one-on-one and talk about where they're at, why they're motivated, unmotivated, how much motivation is there. Maybe they're just lackadaisical right now. Maybe they're just going through like a 15-year like blues for right now.
Yeah.
The 15th year is just whatever to them, and they're in blasé mode. Maybe they're mad about the economy. I don't know.
Also,
Let's
I don't
uncover that.
I don't want to just gloss over the fact that it can just be overwhelmed.
Could be
Yeah.
that. Could be that.
Writer could be completely overwhelmed with a lot of different things right now.
Yeah. Little kids,
Like,
cancer in the family.
yeah, I mean,
Working partner nonstop.
that's
Maybe the
a-
partner's being resentful.
That
at
is a
you.
that's a whole lot going on there.
Could be.
Yeah, I mean, there is all of that. I think, writer, my gut is that you will kick yourself later if you don't try at least try to do some of the work now.
Yeah.
I think Jim's onto something with doing some singles work. I think that you might. I think that it's a real possibility that you'll regret it later if you don't make that effort now.
I agree.
And let's look at it this way. You've been in this relationship for 15 years. You've been married for 10 years. You have 2 children
A big investment.
with your spouse. You've invested a lot of time.
Yeah.
If you're and as far as we know, there is no abuse. There's nothing like that. So I mean, invest another 2, 3, 4 months
Yeah.
of doing some work. Maybe even doing some weekly work or some twice a month type things with someone just on your own.
I like
And
that.
then maybe getting back into couples counseling if that's where you and your therapist think that things need to go to.
Right.
I mean, investing a couple more months into this
Worth it.
just to make sure.
Right. Get
Just
it right.
because
Measure
if you
twice, cut once.
if that's it. Because if you just cut bait and run at this point, which it sounds like that's kind of where you're at,
You're discouraged.
Yeah.
You wonder if it's just doomed to fail.
then what I don't want is in 3, 4, 5 years from now,
Look back.
you go like, shit. Now I've got an 8-year-old
Right.
and how old was the other kid?
11 at that
There
point.
you go. Yeah. So
11.
I've got an 8-year-old and an 11-year-old. We're looking at heading towards middle school.
Right.
We're doing all these things. We've got more things going on here. Like, I don't want you to look back at this moment now and go, fuck, I should have
Right.
tried a little bit harder
Leave it all on the field.
then.
Yeah.
Yeah.
Play hard now. And one of the
And
things
and
that-
the answer might be that it is over.
it might be.
And that's
I
fine.
want you to discover that authentically, not because of a lack of motivation at this present moment.
Yes.
Because you could just be, as Jacob said, you could just be burned out.
Yeah.
It's a weird world. You're
And man, would I
parenting.
not blame you for being burned out.
Yeah, you've been married for 10 years. Your husband's going through a hard time. There's cancer in the family. There's so many reasons. And the truth is, the two of you haven't been meeting each other's needs, whatever those human needs are.
Right.
Doesn't have to just be sex. Could just be, when's the last time you saw your spouse in a great mood? And
Right.
they added joy to your life instead of coming to you looking for comfort to, salve their wounds. Like, okay, maybe that's just drained you at this point. But the fact that you lack any interest in the marriage or holding on, I want to scrutinize that first. Not scrutinize, but I want to examine that and elicit the insight you need to figure out your next step.
Yeah.
That's where I'd start. And then if from there, if you decide or your individual work says, hey, let's go to couples, at least you're going to couples knowing your goal. And you might have the goal of ending the marriage, by the way.
Yep.
We don't talk about that enough. A legitimate use of couples therapy is hospice. You can come in and say, we're here to bring this to a gentle end and be really great co-parents and friends. And we like each other enough to get to that point. Great. I have done that with many couples.
Yeah.
And I
We
think
don't
that's
talk about
legitimate.
that enough because
Yeah.
that is a really great use.
You're not always there to get fixed.
Yeah.
And I ask couples, what do you want from me? And
Especially
sometimes
with
they'll
kids.
say that. Yeah, hospice us, bring it to a gentle end.
Yeah.
Or they come in and go, well, his motivation is to have a really fulfilling, this kind of relationship. My motivation is, let's keep this band together. We've accomplished a lot. So we're going to find that middle, Jim, find the Lagrange point between those two. Great. We'll do it.
You're Slash and Axel.
I like that. We're at the end of the show.
We
Mercifully.
could have made another $1 billion in our career, but instead here we are with Jim Jobin. Slash and Axel.
Slash and Axel.
You've done it again. You've wasted another perfectly good 2 hours of your life if you're a Patreon, listening to Pod Therapy. And we want to thank all of you who are patrons of the show who make it possible.
By the way, Jim confused the words attribute, attribute, and adjective, just in case he edited any of that out.
None of that happened.
So just make
None of
sure
that happened.
if you didn't hear all
I
of
am
that
brilliant.
earlier, make sure that you write Jim
No, it's all been
and get
removed.
get that information.
This has been removed too. Also, we want to thank Shirts.
Yeah, thank you everyone who participated in the mental health
The
awareness
show's
month.
just going to be two jingles.
And,
It's just going to be the open and the close. I can't afford to have any of this hit the stamp.
Everyone who bought those shirts, by the way, you have wonderful attributes.
Yes. Yes.
Your attributed adverbial, I don't know.
And we attributed the money that we made
Stop trying to teach
to
me.
Nami.
Stop
So
trying to teach me.
we made a donation to
Wonderful.
Nami on behalf of the show.
Yep.
Big thanks to all of you for those the t-shirts because
Yeah.
100% of the proceeds went to Nami.
You
so.
guys made it possible. And we chipped in some extra on top just to make sure that we were throwing some skin in the game as well. So thank you guys and everybody who's supporting us at patreon.com/therapy. And we got some new folks to thank. We got a new therapal, Andrew.
Thank you, Andrew.
Hey, Andrew.
Hi, Andrew. Thank you for joining the
Sorry
party.
about today.
Yeah.
Sorry. Yeah.
Sorry that this was your first Patreon. It doesn't get any better, Andrew.
And we have a slew of new
We
therapy
do.
producers.
This was awesome.
The boardroom got
We had
busy.
to add seats.
Yeah.
We had to add seats to the boardroom.
we're going to be tearing out a wall.
Yeah,
All
that's
right.
right. Yeah,
We're
we have
gonna
an
be,
annex.
Yep.
Yeah, we're seating them in the lobby now.
So we've got Take It EV podcast.
Love
Welcome.
that
Hey.
podcast. Great show.
We got Cody Mitchell. Thank you for joining us.
Yeah.
Kodiak.
Kodiak.
And about an hour before
Oh,
we
that's
started
right.
recording,
I saw that. Yeah,
we got Paris.
that's right.
Welcome.
Pronounced Paris. Thank you. Wow, 4 new therapy producers. That's awesome.
Wonderful.
And Andrew, thank you for joining. And of course, we want to thank our expanded seating section in the board, the mysterious and shrouded Illuminati members of our fan club, the therapy producers. Let's see if I can get them all in one breath. Thank you. Smitty Scoop, Jake Schneider, Robert Brownie Jr. Mint, Kayla Lansbury, Judy Schneider, Nathan's Hot Dog Scoop, King of Student Loan Debt, Dr. Ben Don, Crazy Banana Scoop, Mason Miller, Carolyn Albert, Leon Kassab, Kevin Chamberlain, Malia, Richard Macy, Cindy Ash, Newstick, Lord Colin Stewart, Dirty B, Ben Stanley, Sammy Scoop, Sarah Smith, Adam Hathaway, Byler T, University Jeff, Tess Miller, Take It In Podcast, Cody Mitchell, Kodiak. Who was the last guy?
Paris.
If you'd like to hear this episode uncut and unedited,
And I can think of several reasons that you wouldn't.
you should go to patreon.com/therapy. Oh man, I am dizzy. Thank you for supporting mental health. Is it me?
Yep.
Thanks. That's all the
Still
time
you.
we got for this week's session. Did I read your part?
Yeah.
Oh,
It's okay. We haven't been doing this for 3.5 years.
we appreciate it. Remember, pod therapy isn't something you should keep all to yourself. Share the episode with someone who needs it by opening the description in your podcast app and copying and pasting the link provided in social media. Don't forget, you can find us at facebook.com/podtherapy, on Instagram at PodTherapyGuys, on Twitter at PodTherapyGuys, and at patreon.com/therapy.
Do you want to submit a question to the show? Ask anonymously at podtherapy.net or email us at podtherapyguys@gmail.com. I'm Nick Tangeman.
I'm Justin Robert Young.
Thanks. We'll
Throwback
see
to
for
the
your
intro
appointment
when I
next
said we were taking over politics
week.
and law and grammar.
It bothers me when you do that because I know what you're going to do is you're going to tag them
No, I don't.
on Twitter.
I will have forgotten by the time it's complete.
I guarantee you won't.
I guarantee I've never tagged anybody in our outs. I've impersonated all sorts of people. Also, the least likely person to give a flying fuck is Justin Robert.
It
Young.
doesn't mean
He
you
will not
won't-
care.
It doesn't mean you won't do it.
I've literally met him in
does not-
person. He will have no clue who that guy
Yeah,
is. What?
doesn't
I have
mean you
pictures
won't do
with
it.
this guy? I have no fucking clue. Jacob's friend? I have no fucking clue. That show Brian was on? Who's Brian? He does not care. Promise you he does not
It's the most of this music I've ever heard.
I know.
Tagging him
yeah.
would be absolutely pointless.
Do the send off.
Thanks. We'll see you for appointment next week. I already said that.
Oh, good.
Award-winning programming, this show. Award-winning. This is just the best of the best. This will end up on the best of.
Bye.
Jim trying to wrap it around and tie things together is just terrible.